Obviously, there's been a great deal of media attention within the past year, both from some very horrific high-profile cases that occurred, but also for the push for privatization as well for the foster care system. And rather than making long-term impactful decisions regarding the safety and well-being of children in too quick a fashion, the governor felt it was very important to have a commission look at this very holistically, all the issues that touch children, to see how we think creatively about leveraging the strengths that are in Georgia, where there are issues that need to be fixed, where we currently have strengths in the system, and despite what you may hear in the media, there are strengths within the system, and there are good things to highlight that are happening here in Georgia. We do know that there is much work to be done. There is the breaking down of silos that needs to occur. So we want to think creatively. We have a goal given to us that going into the 2015 session that we will have a list of recommendations for that session. But beyond that, we also want to look at this public-private piece. How do we think very creatively about some opportunities to work across those silos to strengthen the network and also the safety net for the children and those families. So we've had our first commission meeting a couple of weeks ago. We have they are open to the public. All of the materials from those meetings are posted on the website as well. So you can access that at any time, all the research, the data around Georgia. We are trying to be as transparent as possible in this process. We have an upcoming meeting at Emory. Our next one will be at CHOA after that, because we also want to circulate these meetings throughout the community as well. But we had about 50 extra folks show up for the first meeting who were not a part of the actual commission, which I think speaks volumes to how much our community cares about what's happening to our children and how invested everyone is. And we were excited to see that level of turnout. The mental health aspect of this is a critical one. I have met with Commissioner Berry about this issue to figure out, where partnerships are, and obviously we're just in the very beginnings of this process. I will be honest with you and tell you that I am on a journey of learning all of this as well. The mental health side is one that I am not as familiar with, and unfortunately, the mental health side is one that is particularly deficient at addressing the needs of children, particularly young children. But if you look at psychotropic medications in the state of Georgia, about 30-some% of our 5 to 9-year-olds in this system are on psychotropic medications. Go out again. So it's significant. One of the things that's currently happening in Georgia, and I know Ellen just came in the room, Ellen Cochran. Can you stand up, Ellen, so everybody can see you? Ellen is on the GEARS staff, but she is our liaison for the Frontiers of Innovation program that we are doing in partnership with Harvard's Center for the Developing Child. And we are looking at social and emotional well-being of our youngest children, because one of the things that research is now telling us is that children that are in toxic stress households, which, if there is abuse occurring, if there's domestic violence, if there's substance abuse, any of those factors lead to a toxic stress environment. It affects the child's mental health development. And so through the Frontiers of Innovation program, we are going to be looking at ways to help address these needs to hopefully maybe prevent children from needing psychotropic drugs. What they may need is early intervention and an appropriate outlet to handle what they're dealing with at home. So that's an exciting thing. We're only the second state in the country to be doing this work with Harvard. Washington is the other state.
As we move toward child welfare reform, can in-school education and prevention programs on child abuse and neglect and digital safety for kids, grades 1 through 5, be considered as part of the mix of all forms of abuse and child safety?
I'm so glad you brought that up, because we know one of the issues is there is probably more abuse going on than we realize, but the reporting is an issue, but also the recognition of it is an issue. And through Children's Healthcare of Atlanta, Dr. Jordan Greenbaum, I don't know if you know Jordan, she's a shero for sure in the state, but she is going to be partnering with DFACS on helping more training, expanding the telemedicine programs so that there is more identification of child abuse. But we know we've got training opportunities. We have pediatricians in this state who don't know, unfortunately, how to recognize sexual abuse because they've never seen it. But that's slowly beginning to change, but we do have opportunities there for increased training within the schools with school nurses. Those front lines of defense often, are within the schools or with coaches. So we want to look at, how do we not only make it more understandable on how to identify abuse and neglect, but then also how to make that reporting easier. But DFACS just they have it up and running now. Their new call intake center, and their calls have more than doubled since the intake center went into effect, because it's a unified state call-in. What they were finding is that in counties, because oftentimes the call center responder knew the person who was calling in or could figure out who they were, there wasn't that level of anonymity, and it was actually preventing people from calling in. So with this now statewide intake center, we're hoping that because of that, increase in that feeling of anonymity, and we're already seeing that, it does give us some challenges. We need to make sure the call centers are adequately staffed to handle the volume, and that they know how to adequately triage the calls that are coming in as well.
Many children and families in Georgia who are in need of services in the child welfare system are non-English speakers. In my experience, appropriate services are extremely limited in this area. How is this being addressed?
That is one we don't know specifics on, but we would agree, particularly in certain counties, we know that this is a huge issue for these families. We've had conversations with folks in Dalton about that, Gwinnett, etc. So everything that we do going forward, we need to look at, are we addressing the needs of those families as well. I think as part of this is figuring out incremental steps to success. We may not be able to have enough English as second language, trained counselors, but we may be able to incrementally help increase at least communication being done effectively by translators, and that may be an example where we could partner with local colleges and things like that. It's maybe not the perfect answer, but it might be the first step at addressing a need.
The other thing I would add to that is understanding that need is critical for us, because really at the end of the day, that's a workforce issue. And, if there are incentives we need to put out there to encourage people to take that career path, or if the salary structure needs to be different, those are things that we need to be considering. And so understanding that need and how great that need is, that certainly, I put it on my list of things we'll do as we go through the council's work. But that's really at the end of the day a workforce issue, and certainly something that we can think creatively about how to address that issue.
The next meeting, which we are doing at Emory, will focus on, this one's focusing on the parent, or the caregiver side of it. We want more information about who they are, what are their responses to the system, why do they do the things that they do. And these are huge questions, but we felt like one of the things that we needed to educate the commission on is looking at this through the eyes of the abuser and understanding what their needs are as well. So we are partnering, drawing a blank on Peggy Walker, will be partnering a lot with us on this particular meeting, as well as Melissa Carter through Barton. The next meeting will be done at CHOA, and we're going to have Jordan Greenbaum presenting at that one to look at it through the eyes of the child. What is it like to go through this system if you've been abused, both from a physical standpoint as well as an emotional one. So we will be bringing in outside experts to look at this. We are also going to be having a session on national best practices. We've already talked to Casey about helping us identify national best practices in this arena as well. So we really want to draw on the strengths of our community. But obviously, you know, this is not a one-sided issue. It's got, you know, many arms to it. And so in us trying to get our arms around it, we've got to look at as many angles as possible to figure out, you know, where are the overlooked opportunities? And so that's why we're spending time at going in depth, you know, what does this mean to a parent? What does it mean to the child? And lost it again. And that's going to take some time, and I go back to the young man next to you, Pat. I'm sorry, I forgot your first name. Malik. It may look for a while like we're sitting in meetings, but the purpose of sitting in these meetings is to really listen, learn, and understand before we take action. And that's what we're going to be trying to do.